Hello, curious minds, and welcome to Brainetainment, where we quench your thirst for knowledge. Here at Brainetainment, we strive to deliver content that enlightens, educates, and entertains. Our goal is to ignite your curiosity, encourage you to ask questions, and inspire you to learn something new every day. We cover a wide range of topics, all meticulously researched and presented in an engaging manner. Today, we delve into the world of medical science, specifically focusing on kidney stones. You might have heard of kidney stones, but what exactly are they? A question you may have asked yourself at some point, and one we're about to delve into. Kidney stones are, in essence, hard deposits made of minerals and salts that form inside your kidneys. A little like unwelcome guests, they settle in without an invitation and can cause a whole host of problems. Let's break down what these stones are made of. The composition of kidney stones can vary, but they're typically composed of calcium combined with either oxalate or phosphate. These are substances that we all have in our bodies, so it's a bit like your body turning against itself, creating these painful stones from materials that are ordinarily harmless. However, these calcium-based stones are not the only types you might encounter on this rather unpleasant journey. Struvite stones, for instance, form as a result of certain types of urinary tract infections. Uric acid stones, on the other hand, can form in people who don't drink enough fluids or who lose too much fluid, those who eat a high-protein diet, and those who have gout. Cystine stones, a less common type, form in people with a hereditary disorder that causes the kidneys to excrete too much of certain amino acids. What's fascinating, or perhaps more accurately alarming, is that these stones can range in size. Some are as small as a grain of sand, while others can grow to the size of a golf ball. The smaller ones might pass unnoticed through the urinary tract, but the larger ones, well, they can block part of the urinary tract, such as the ureter or urethra, leading to severe pain and other symptoms. So kidney stones are essentially hardened lumps of minerals and salts that form in your kidneys. They can be composed of different materials and can range in size from tiny specks to large, painful obstructions. But this brings us to another question. Now that we know what kidney stones are, how do they form? A puzzle we'll solve in the next part of our journey into the world of kidney stones. Kidney stones don't just appear overnight, there's a process involved. Now, let's delve into the formation of these pesky pebbles causing havoc in our bodies. Kidney stones, scientifically known as renal lithiasis, primarily form when there's a decrease in urine volume or an excess of stone-forming substances in the urine. This imbalance often results from dehydration, one of the main culprits in kidney stone formation. When we don't drink enough fluids, our bodies create less urine, which is more concentrated. This concentrated urine is a breeding ground for kidney stones, as it allows minerals and salts to come together and crystallize, forming the stones. But it's not just dehydration. Dietary factors also play a significant part. Consuming food high in certain substances, such as oxalate, found in foods like spinach and rhubarb, or animal protein like red meat, can increase the concentration of these substances in urine. When these substances become too concentrated, they too can form stones. Excessive salt intake can also be a factor. When we consume too much salt, it increases the amount of calcium our kidneys must filter, leading to a higher risk of kidney stones. So that extra sprinkle of salt on your chips might not be such a good idea after all. Certain medical conditions can also increase the risk of kidney stone formation. Conditions like renal tubular acidosis, cystinuria, and certain metabolic disorders can lead to an increased concentration of stone-forming substances in the urine. Moreover, some medications can also contribute to kidney stone formation. For example, drugs like topiramate, used for treating epilepsy, or indinavir, used for treating HIV, can increase the risk of kidney stone formation. In conclusion, the formation of kidney stones is a complex process influenced by a multitude of factors, including hydration levels, diet, certain medical conditions, and even specific medications. So, it's clear that kidney stones form due to a combination of factors, but how painful are they? Let's dive into that in our next segment. Kidney stones have a notorious reputation for being extremely painful, but how painful are they, really? Let's delve into the throes of this discomfort and try to comprehend what makes these tiny stones such formidable adversaries. To understand the pain of kidney stones, we must first appreciate the role of the kidneys. These bean-shaped organs are our body's natural filtration system, working tirelessly to cleanse our blood and expel waste through urine. Now imagine an unwelcome visitor, a kidney stone, disrupting this smooth operation. Kidney stones are hard deposits that form in your kidneys. As they make their journey from the kidneys through the narrow ureter towards the bladder, they can cause excruciating pain. This pain often starts in the back or side below the ribs, unrelenting and often spreading to the lower abdomen and groin. The intensity of the pain can fluctuate, ramping up as the stone moves. But how does this pain compare to other well-known painful experiences? Many who've experienced kidney stones liken the pain to that of childbirth or even being stabbed. While this might sound overly dramatic, the comparison is not entirely unfounded. The pain from kidney stones comes from the intense pressure and blockage caused by the stone, similar to the pressure and pain experienced during childbirth. It's also worth noting that the pain isn't consistent. It comes in waves, much like contractions in childbirth. One moment it's there, sharp and intense, and the next it subsides, leaving you in a state of anxious anticipation for the next wave. It is this combination of intense pain, the unpredictability of its occurrence, and the relentless nature of its waves that make kidney stones a contender for one of the most painful experiences a human can endure. And so, we find that the reputation of kidney stones isn't exaggerated. They truly are as painful as they are notorious. It's no wonder then that kidney stones are often described as one of the most painful experiences a human can go through. Now that we've established how painful kidney stones can be, how can we prevent or treat them? Let's delve right into that. Firstly, prevention. One of the most effective ways to prevent kidney stones is by staying hydrated. A well-hydrated body is less likely to form kidney stones because it has enough fluid to dilute the substances that can form stones. So drink up, folks. Aim for at least 8 glasses of water a day, but remember, the amount of water needed can vary depending on your climate and physical activity. Next, a balanced diet plays a crucial role in preventing kidney stones. Limiting sodium intake can help reduce the amount of calcium your kidneys need to filter, thus reducing the risk of stone formation. Foods high in oxalate, such as spinach and rhubarb, should also be consumed in moderation. On the flip side, consuming foods rich in citrate, like lemons and oranges, can help prevent stone formation. Regular checkups are also essential. Routine urine tests can detect any changes in your urine that may indicate the early stages of stone formation. These checks can catch potential problems early and help you nip them in the bud. Now, let's shift gears to treatment. If you've already developed kidney stones, don't fret. There are several treatment options available. Medication is often the first line of treatment. Doctors may prescribe certain medications to help pass smaller stones. These medications can relax the muscles in your ureter, allowing stones to pass more easily, and can also help manage pain. For larger stones that cannot be passed naturally, a procedure called lithotripsy might be recommended. This involves using sound waves to break the stones into smaller pieces that can then be passed in your urine. It's non-invasive and usually very effective. In some cases, surgery may be necessary. A urologist can perform a procedure called a ureteroscopy to remove the stones. They use a thin tube to reach the stones and either remove them or break them into smaller pieces. And there we have it. Prevention and treatment of kidney stones in a nutshell. It's important to remember that while these treatments are available, it's far better to prevent stones from forming in the first place. After all, they say an ounce of prevention is worth a pound of cure, right? Remember, prevention is always better than cure, especially when it comes to something as painful as kidney stones. Kidney stones are clearly not something to be taken lightly. We've journeyed together through the intricacies of what these stones are. Crystalline formations within our kidneys, a result of an imbalance in the substances our urine carries. We've explored how these stones develop, how they can silently form over time, turning our kidneys into unwitting hosts. We've also delved into the excruciating pain that kidney stones can cause, a pain so intense that it's often compared to childbirth. Yet despite the discomfort and potential harm they bring, we've seen that there are ways to prevent and treat kidney stones. By staying hydrated, maintaining a balanced diet, and seeking medical advice, we can take steps to avoid these unwelcome guests in our bodies. Thank you for joining us on this journey of discovery. Remember to subscribe to Braintainment for more insightful content. Until next time, stay curious,